So now we're going to look at the hip. When you have the hip, it's kind of confusing because this is normally what you're going to see. What you'll see is one side of the hip. It'll look kind of strange, and actually it's three bones put into one. It's the ilium, ischium, and the pubis. You might also see it like this, where you'll see it combined. And if you see it combined, you can see that they have these little flaps right here. This is what you can feel on your hip. And then you'll see this little piece of cartilage right there. And that piece is called the pubic symphysis, which is going to be important in childbirth. But another thing to kind of look at is this is going to connect it together. So this gives us what's going to be front, what's going to be back. So what we need to figure out when we look at it like this, what's mediolateral and what's superior and inferior. So let's first kind of just turn it around and kind of look at the structure. And if you look at it, one structure kind of sticks out. And that's this hole right there, this indentation. This hole or indentation is called the acetabulum. And that's going to be where the femur fits into it. So the acetabulum is always going to point lateral because your femur is going to attach into it, which means this side is going to be medial. Now you need to determine what's front and what's back, or anterior and posterior. And the easiest way to do that is, where's that pubic bone that we talked about when we saw the pubic symphysis? And if you look at this and just kind of compare these two little structures right here, you see this little hole right there, we'll get to in a second, but this part of it is going to be a little bit narrow, and this part right here is going to be a little more, how do you say, bumpy. So let's kind of look at it. So if you look right here, it's narrow, that looks pretty narrow, and this back part right here is going to be a lot thicker. Now if you turn it over this way, narrow, narrow, thicker with that rough spot. So this narrow portion is going to be the part of the pubic bone, and this thicker part right here with that rough spot is going to be your ischium. So the pubic bone is going to be pointing medially. So when you look at it like this is going to be the front, the ischium is going to be the back. And if you look at this rough spot, that's your ischial tuberosity. And the reason why the ischial tuberosity is important, and the reason why I always instruct students to go to the library and touch and feel the bones, you can feel that this is rough, which is a perfect attachment site for a lot of the muscles in your hip, and especially your butt. So it's important to know the ischial tuberosity and the pubic. So now that we got, this is front, that's pointing out, now we can determine what all the other structures are. So I mentioned that there's three bones. We found the pubic bone, we found the ischium back here, all of this up here is going to be the ilium, which means this little part right here that you can feel on your hip is your iliac crest. Now, this is front, the one pointing to the table is back, and you can find out, or you can kind of see there's two little indentations or bumps. This is the anterior superior iliac spine, anterior inferior iliac spine. Very long words, but because this is the front, anterior, and it's above superior, your anatomical terminology is going to come in handy during this part. And because there's an anterior, there's got to be a posterior. So you'll have posterior superior iliac spine, posterior inferior iliac spine. And those are these two right here. So you can see the front two, the anterior superiors, and then the posterior superiors, and then connected between them is your iliac crest. Now if you look right here, you can see that there's a little indentation where my finger can kind of go into. And I just want to show you the purple part right there. That part right there is your greater sciatic notch. The one where my pinky is going to be, that one down there, that is your lesser sciatic notch. So lesser sciatic notch, greater sciatic notch. Those are important because that's where the sciatic notch kind of comes around and comes in close contact with the bone, where it goes out and in. And that's important because there's a lot of muscles here, and if those muscles get strained or tightened, they can push the sciatic nerve up against the bone, which will cause a lot of pain. Now if you kind of sit there and think, we did the posteriors, we did the superiors, we did the sciatic notches, we did the ischial tuberosity, we're going to go back to this hole. It's a large hole. You have an obturator nerve that goes through it, so that hole is your obturator foramen. Then if you kind of look at the rest, we already did the acetabulum, and the rest of them are all going to be done. So that is all the things you need to know on the hip.